Yeah, good evening, ladies and gentlemen, and special thanks to Express Healthcare for planning this type of session as far as digital transformation, because this is a buzzword nowadays, and we as a CIO would like to be a part of this transformation journey, and we can understand that it's a top-down driven approach as far as digital transformation. But as the topic starts, I would like to set and I would like to give you more insights about the profiles of our different panelists. Starting from right hand side, he is Kapil, and the Kapil Mehrotra. He is taking care of HCL Healthcare. He is giving me good insights as far as the digital transformations are concerned. 23 years of experience. Thanks, Kapil, for joining us. Next to Kapil, Pradeep Saha. He is taking care of Max Healthcare, long veteran. 30 years of experience in this industry. Thanks, Pradeep. Now come to a lady, Shilpa. Shilpa is taking care of Aakash Healthcare, taking care of IT as far as domain are concerned. Good experience of healthcare and as well as other domains also. JP sir, taking care of Rajeev Gandhi Care Hospital as far as ITs are concerned. Thanks, panelists, for your joining us. Yeah, as far as the topics are concerned, digital healthcare enterprise myth and readiness, right? And I would like to share you more insights as far as digital healthcare is concerned. Yes, we know that this is a buzzword nowadays, and we have to drive this initiative. What's your thought as far as digital healthcare enterprise from the basic? Let's start with basics first, then we will talk about in detail. Yes, over to Kapil.
Digital health is a buzzword right now, and everybody is looking towards that. Especially in the healthcare, like it's really add a lot of flavor, add a lot of value. Reason is because whenever we start healthcare and we talk about the healthcare, so people look up to that particular service provider from a different angle perspective. Because specialty perspective, what all the like specialists you have, and how you have been basically treated to those customers, those patients. If we look at it, the model of the healthcare, wherein typically like people will talk, okay, have a EMR, have a portal, have a mobile application. That is not only the digital. Digital is that it's a culture where everybody have to contribute. Wherein, let's say you have a team of 100 doctors or 200 doctors, they are thoroughly using your services, whatever IT enablement you have done it for the organization. That is one. And how open are you to use it? Because the problem is that the doctor is resistant. They are so busy. If if you go to OPD, they will not use it. Reason is because they are bombarded with the 200, 300 patients in a day. If a very good doctor, so he must be dealing with this number size. And it's very difficult. So you cannot give this part to the assistant. They can take the information, they can later put it there. That's not the right way of doing it. It means you have to basically use everything from the inception. The advantage of using the digital thing is, let's say, if you see the patient life cycle starts from the registration, then go to the basically vital, and then after that it goes to the doctor. Doctor basically put this clinical records there, and then after that you can get that data in the EMR so that you can run the further analysis over that, right? Including the lab results, including the clinical notes. If someone is not put in data in the EMR, I cannot run the algorithm. So digitization from the inception is very important. You cannot lose any touch point. Even your feedback is also playing a lot of value. So all these things are a part of the 360-degree enterprise digitization. That's what is my thought. It's very important to touch upon every point.
Thanks, Kapil. Pradeep, do you have a same view, or you have a different opinion?
There's no reason that I should have view. See, your topic says it's a reality or myth. Let me tell you things like e-health, m-health, telehealth, all this technology. Finally, these are all revolution towards digital health, and it's a reality. You just can't. Talking about digital, while we can talk and touch a lot of things, and we might all talk the same thing. One thing that digitally that has come to our help in the medical world is not only concentrating care at hospital, but also care at home. That care at home has become simple today because digitally we are able to connect the patient and the care. This is one thing while I will be covering when we talk more. Within the hospital digitally, how do we save life? So if I have used my digital technology to do these two things, then probably to the CFOs I have replied the return of ROIs for digitalizing the costs and other things. So it's a reality. I agree with him. We'll talk more on that.
Okay. Shilpa, over to you.
Yeah, actually digital health is a very vast subject. And if we'll speak, then I think everybody will speak on the same thing, EMR, PACS, this and that. So if we compare, traditional hospital with digital hospital, same thing was happening in traditional hospital as well. The doctor is, writing the chief complaint and what all diagnosis required, all the medication required, and all those things. And then, follow-ups, and then might be next time if the patient is going to the hospital, might be he doesn't have that lab report or X-ray report or that prescription itself. Then might be there would be the duplicacy of the test, retest again, and might be the diagnosis would be not very accurate because might be he has referred to some other doctor as well because of chronic disease. He could have referred so many doctors, but at the time he visited particular doctor might have missed some prescription or report. So it affects the diagnosis. So what is the benefit of digital? We can't in traditional way, if all the handwritten prescription, then where we'll do the analysis? How we'll do the analysis? For doing any analysis, we need the data, and from where data will come. Then the digitization comes into the picture. And through the digitization, basic all the requirement will be consolidated at a single place, at a glance, on the real time. Access anytime, anywhere from any of the authorized doctor. So it will be helpful for the patient, for the doctor, for the hospital, and for for improving on this thing. If the data is there, analysis will be there, then there is the window to improve. So I think this is very vast subject, but why it's all required? Because continuous improvement is part of the life cycle, and continuous improvement will happen only if the analysis will be there, performance will be there, then we can think about to enhance the performance or reduce the bottlenecks or any issues. So that's why digital health is required to take.
JP sir?
Yeah, so it is very easy to say I agree with all of them.
We want your experience also.
So there is a difference between digitization and digitalization.
I'm coming to that point also.
So digitalization is making the entire process digital. For about a decade, there are 4 technologies that have been a constituent part of the digital world. And we call them SCAM or SMAC. Social, mobility, analytics, and cloud. Now 5th dimension has come, and that is blockchain. Because the security and keeping the record light is also important. Now, how this digital applies to the hospitals. Right from the point of service, when we acquire the data, it should be acquired painlessly. So there are Fitbits, there are devices which are acquiring our vital parameters. There are ways to acquire the health data without anybody typing it. So there are bots, they are observing the behavior, they are recording, and it is affecting in both levels. Healthcare is actually a combination of two words, health and care. And it is affecting both the components, health component as well as care component. Health is more about treating and care is more about experience. So digital is affecting both the dimensions, and it affects complete life cycle. Starting from the acquiring the data, then doctor is writing a prescription. Digital technology ensures that this prescription is served up to the end point without anybody interfering. So without introducing a chance of making an error. Similarly, digital is analyzing where the peak loads are there, where the spare capacity is there. It just does some sort of level playing, bringing operational efficiency. So digital is touching all aspects of care in a way.
One more thing. Are we planning and are we going ahead as far as computerization of our old manual process and considering these automation to be considered as a digitalization? Or digitalization is a different ballgame?
So digitalization should never be the aim or objective. The objective, it is a means. It is a means to provide service excellence, to provide operational excellence. What we need to do is start from today. You need not worry about the myriad of the paper records that is available there. That can be scanned and that can be put to use by a different set of technologies. At least start the journey today. And I'm sure our doctors will be very happy seeing the information in the dashboard available on one single sheet. From my experience, I can tell you that 90% of our patients are the patients who have been registered in past 12 to 15 months. So those are the active patients. And if we start building that data and start showing in one single screen easily accessible data, I think it will help.
As far as the patient uniqueness are concerned, I'm talking about the uniqueness of a patient. In my industry, as far as we have a 60% of business coming from network. And the uniqueness and identification of a data is one of the biggest challenge. Though we have a 40% load from walk-ins, we have a accurate golden records of my patients. But the 60% is still on the struggling phase. Are you guys, how you are managing this type of challenge in healthcare, in hospitals?
Yeah, that is very much. Let's take a classic example. If someone has a 5 family members and coming for the health checkup. So what they do is they put the email ID and the mobile number same. As an IT person, what we do, we give them unique ID to everyone. But whenever we basically consolidate, we cannot consolidate because something you needed as a unique ID to basically join records. So if everybody has same ID or same mobile number and email ID, so how do you basically combine them? You cannot basically identify those records the way you are thinking, the way you have designed your system. So that's one of the challenges even like my company also is facing is because everywhere like we put, people are coming and they are putting same phone number and email ID. That's one of the very much like challenge which we are facing. Other one is people are not serious. Let's say I'm a repeat customer. I'm coming and I'm carrying 3 numbers. So I don't care like what number is registered in the organization. So generally, if you go on a reception, you tell your number. If that number is not found, they will create another account.
Now changing more intense questions. And as far as digital transformation, now we are taking care of digital transformation as a roadmap as far as healthcare is concerned. And healthcare is trying to be in that particular phase where other industries are already there, like retail, airlines and banking. And customer is at center. And we have to fulfill the customer experience and engagement because the customer is same, whether it is from airlines industry or whether it is from healthcare industry. industry. And customer wants choice and control. And if we want to touch each and every touch points of our business channels, customer is same. As far as the digital transformations are concerned, how readiness as far as your organization from digital transformation from the roadmap perspective?
So we are growing now. I cannot say we are 100%. We are have a roadmap ready with us now. So one-sided, like we are trying to basically upgrade our underlying infrastructure. Second side is like those are the legacy systems we are trying to basically develop and make it better and exposing webinarly. Other side, if I look at like, because it's a 360-degree effect, I mean, you cannot leave it one side if you are making a digitize, other side you will do it later, right? Because because there are so many processes, as JP sir said, you have to look the processes as well. Because you cannot ignore the process. You may develop the technology, you may develop the solution, but if you're not changing your process, you will fail. So it's a handshake together with the operation, wherein like if they are ready to adopt the technology, what you're bringing in, the solution you are bringing in. Because accordingly they have to change the system. If you go by the processes and then trying to figure out the system, it would be really difficult. So it has to be win-win situation. And thirdly, AI. Because whatever we are doing in digital world, right, we are trying to basically have the easy functionality later. Let's say in a traditional way, we were recording the records, PI information, PHI information, and we are breaking it to the different level for the research purpose, for the analytics purpose. But bringing AI now, wherein data is flat, whatever data you have, it will basically gives you the result, whatever algorithms you built in. That is very helpful now these days. I am giving you a classic example. Let's say X-ray has been taken and let's say it has a critical problem inside lung. It will tell you then and there, this is a critical patient, you have to refer to the doctor immediately. That's the advantage of the AI. Because you have the algorithms in place, you have a past data available, on the basis of that you have written the algorithm. When the X-ray is happening here, immediately next patient, if has a critical problem, immediately intimate it. Otherwise, what is the process? X-ray is given to you, you go back to home, you may be serious about that X-ray or not X-ray, this may be slip. So those things are very important from the digitization as well.
Okay, thanks Pradeep. Your view?
From the previous panelists, we heard that 44 decades you are in health, you are in the surgeon, and now you are in the administration. I also have other, we know the other panelists who were in this industry since more than 2 decades. From the business point of view, we heard. Now we are from IT. We can only justify how digitization is over a period of time, since ages, has helped us. 2 examples we give for your question that we practice in our hospital. One is the bar-coded medical administration. The survey says that many patients die due to wrong medication. Now this wrong medication can easily be taken care by bar-coded medical administration. So this world today has allowed us to use the barcode to identify the patient, to identify the medicine, to tell that this is the right medicine to the right patient, in the right time, in the right dose, in the right route. So that is the help of the digitization, where the error has almost come down to a single digit from about 30%. Similarly, patients, many patients in hospital, they die because of hospital-acquired infection. So if I have used my technology to save life, digitally ensuring that this patient at least should not die in my hospital because of my hospital reason. Patient has come to get cure and go back home, but not to die here because of the infection that the patient got over here. So that's something called ventilator. When the patient is in ventilator and patient is out from the ventilator, you being the family members, you feel so good that the patient, my person is out from the ventilator. But you would not know that internally by that time the ventilator is out, the patient has already acquired an infection for which he again goes back to the to intensive care. Here is where the digitalization, the digital world has helped us to ensure that there is a right alert in the right time to tell to the right people that this ventilator needs to be changed or do the right thing, so that there are some protocols in all hospitals to ensure that the patient don't get infection from the hospital. How to save the patient getting infected in the hospital? This is where from IT we help the technology and give it to the doctors, so that helps them, and that is where their interest rises, that yes, we should be using electronic health record not for the sake of typing, but that actually helps me to save my patient's life. That is what I feel the digitalization helps us in this world.
Shilpa.
Yeah, so I will just add to Pradeep, because in any of the corporate hospital nowadays, EMR is the basic requirement. Is the first thing to start with, EMR. So EMR, PACS, all those things is the basic requirement. Now on top of it, we'll have to see what all are the bottleneck from patient side or from doctor side or from the management side. And then, start preparing that way, so that the customer feel comfortable using. If the doctor is using EMR, he should feel comfortable using the EMR. If nurses are using the EMR, they should get some value add using the EMR nursing module. So same way in all the modules. So basic, like for nurses, people think about the doctor, but not think about the nurses. Generally what mistake, regarding the medication error or something like that, which is directly concerned to the patient safety. Might be nurses forget to give the dose to the patient, or they can miss the dose, or they can, might be give the, wrong dose or wrong medicine to the patient. So this is the bottleneck, how to avoid that. Then there is the intelligence in the system, decision support system in this software itself, which is known as medication administration, which is basically for nurses, so that it gives the window to the nurses, that like an appointment window, for this patient this medication is due, so that immediately it gives notification to the nurse, so that nurse can give the medicine to the right patient at the right time and right medicine. So this reduces the medication error. Same time, from doctor perspective, there are medication like look-alike, sound-alike, or high alert medication, high risk medication, then restricted antibiotics, which cannot be given to the patient, as a casual way. So there is a system which is smart enough to give the color coding to that kind of medicine, that this is the look-alike, sound-alike medicine, this is the high alert medicine, or this category is the restricted medicine. So if doctor orders that medication, then it gives the pop-up. So in case of high alert medication or LASA or high-risk medication, it gives alert to the doctor that this medicine is come into this category. Still, if you want to give or you want to check again. So now doctor can view and the doctor can give accordingly. And same time we get the report from the HIS, how many these kind of medicine has been ordered by the doctor and for which kind of patient. Then it goes to the audit team, they can audit and then ensure that the things are going in the right direction. Same way for restricted medication, like antibiotics which comes into group 3 or group 4, like meropenem and some other that kind of medicine, which cannot be given to the patient like in a casual basis. So it needs one level of approval. So it gives one level of approval. That notification comes to the other person who approves, and then doctor can give that kind of medicine. So these things are which is important for the patient safety perspective. Apart from that,
Please.
yeah. So apart from that, there are a number of things what patient want. See, if patient is at home and he is managing one or other chronic disease like high blood pressure, diabetic, or some other disease, and if he gets the timely report, online report, then definitely his anxiety level will go down because he will see his report, and then he can go visit to the doctor and ask accordingly. So it will be much informed decision he will get, and much focused talk he can have with the doctors. So the patient portal which is there, which can help patient to see their diagnostic reports, book the appointment, do the online payment, all those things. So same way, like nutritional assessment is also very, very important for the patient. If the patient is having a high potassium, then definitely his diet should be like that the diet he is getting should be low potassium content in that. So same way for diabetic diet, normal diet, whatever diet. So the mobile app with diet application, which gives dietitian to do the assessment and planning of the diet on the fly at the bedside, right at the bedside itself, and they tell the patient that you need this kind of diet, like your potassium is high, then these are the options what you will prefer, between these 3-4 options what you will. Then patient will select, okay, give me this, give me this, give me, and then she will tell, okay, food will be coming at this time and that time. So patient is mentally prepared that what he is going to have and at what time. Then definitely rejection is going down.
It is something like a focused approach as
focused
well.
approach, yes.
Right now.
So you see, all these things are increasing patient satisfaction and patient engagement and all those things. So I think the IT is with the help of these technology, we can help patient, not a direct way, but indirect way.
Yeah, JP sir, being as an IT leader, I'm changing the question because it's too much now. Being as an IT leader and digital transformation through this initiative is disruptive in nature, strategic in nature. As far as your organizations are concerned, how you will take this type of initiative, because it is a lifetime kind of initiative as far as complete revamp of your organization. And we have a golden chance to rethink our existing model. We have a golden chance to remodeling our existing processes also. How you will take this type of initiative in your organization? Is a study starting from the third party studies, or you as a leader start initiating discussion with your leadership team?
Great question.
Thank you, sir.
So there is no third party available to help us.
Okay.
I'm sorry I have offended anyone. So we have to work together. This is an ecosystem, and that is why we call it digital health enterprise. So we together form an enterprise, right? You see, Pradeep talked about BCMA, Shilpa talked about CDSS, we talked about infection control. Actually, it's all a journey. And the roadmap, as you asked, and that was your original question, roadmap has certain milestones. This is the end game, that we ultimately involve ourselves into the core affairs of a doctor or a nurse or a dietitian or anybody in the hospital, and actually do the hand-holding and do the proper alerting and telling that this is how you should do your business and this is how you should not do the business. But that is the end game. Actually, the journey starts at a much more rudimentary level. So what I call it is a Maslow's model. In the Maslow's model, at the bottom of the pyramid is actually infrastructure. Do we have sufficient infrastructure? Do we have enough compute power? Do we have enough storage? Do we have some arrangement with cloud? The communication bandwidth, all these things are very fundamental. The Wi-Fi, we must strengthen all our basic infrastructure as a step one. Then step two comes our enterprise resource planning, ERP. Are we managing our financials well? Are we managing our procurement and inventory well? Are we managing our HR well? These are very fundamental modules that must be in place before we aim higher. Then third comes HIS level. There we talk about processes. We talk about admission, OPD, IPD, discharge. All those functions are recorded in workflow administered. Once we have mastered that, then we come to the fourth layer, and that is the electronic health record layer, where we create a single longitudinal record and try to capture the entire journey of the patient so that we can aim to achieve the BCMA or CDSS or dietitian information or whatever. The top layer, ultimate layer, is the digital layer, where we talk about Internet of Things, we talk about chatbots, robotics, we talk about social media engagement and all that. But that is the panacea, and we reach there step by step without really jumping the gun.
Okay, thanks. Very elaborative. Okay. Now, after this type of roadmap and initiatives, what all kind of challenges you faced if you have this type of initiatives in your organization?
In healthcare, two challenges are very common across. The first is adoption. You put a lot of effort, bring your technology, bring processes in place, but doctors has a set mindset and resistance. So adoption is one of the problem, and the training. Whenever you organize a training, people are not having time, and without training you can't roll out anything. So training is another big challenge in the healthcare. So I've been experienced, these two challenges are common. Third challenge is very common, now these days, because security is another aspect, wherein let's say a doctor is a retainer and he goes to the 3 hospital part-time, and he has access of all the data on his mobile. If he is out from your premise, then entire thing is going out. And let's say your chairman, he's dealing with your chairman, he is treating to the VIP patients and all. So he has a lot of information in his mobile. So that information becomes, as an IT guy, for me it becomes as a very critical, vulnerable. So these 3 challenges I see across, except that like everything is manageable. We can talk together, we can educate, because they are very good. You work in a healthcare, you will feel like you are in a very good place and people are so cooperative. So you can convince them with your thoughts and ideas.
But there are mitigation plan against these challenges.
Yes, there are, of course, but it's not that easy. If someone is going out, then you have to look at your budget and the investment and size of the hospital.
You will touch cost.
Correct, of course.
Without the cost and cost.
Yes, of course. Yes, solutions are available, but you have to invest.
Yeah, Pradeep.
So we talked about challenges and adoptions. When do you understand that, yes, I have taken care of my challenges, the mitigation or the adoption has happened? In our hospital, the doctors say that if I don't do the initial assessment of the patient in the electronic health record, then I should not be even allowed to prescribe any medicine, order any medicine. And that's a total adoption. Now, doctor understands the importance of the initial assessment, and that's why they say make it mandatory, so that unless this is there, no doctor can come and make the order. So this doctors telling the IT that make this mandatory for us is a great win-win for IT, that yes, doctors has adopted it. So there are many such things like diagnosis. They understand. They understand how important the data is. So they tell us that make the ICD-10 mandatory, so that on the drop down my doctors can select the code and not just type the diagnosis. Because we understand the value of this data. This data is helpful to know the people in the world, but to the doctors themselves. So we have made that mandatory. There are a lot of other mandatory fields which it's so much mandatory that if they don't do it, they can't prescribe any medicine to that level. So this is the other side of the discussion. One was the challenge and the adoption. One is what if the adoption and the challenges are done. This is what will be in our hospital where we are.
Yeah, Shilpa.
Yeah, currently we are using 100 doctors.
We have less time, you have to be ensured.
Yeah, so doctors are using EMR and they have adopted also, and definitely it was the challenge at the starting time. They were feeling it's very lengthy, very time taking. Then we gave training. That what he said. We gave training, and there are ways how to reduce the time. So create the favorites, create the order set, so that you'll have to click in 2 minutes. You can just your EMR will be through, and then you can give more time to the patient. So definitely adoption was the challenge, but yeah, with the help of training and educating and creating other facilitating with the help of other alternatives, we help doctor to do it.
Yeah, JPDwivedi.
Yeah,
What's your plan, what's your thought as far as cultures are concerned? Yes, adoption is everyone's baby.
So first I'll warn against the codes and selecting the drop down. I have seen 2 incidents. So one gentleman was having cancer in cervical area of spine. The moment that cervical was selected, system generated the row, cervical cancer, and it was selected. Now, during the reporting, it was found how can a man have a cervical cancer? And the second incident was a lady, and it was billing data. So in the billing data, one particular record was selected as a radical prostatectomy. And radical prostatectomy was recorded, and then it was a patient under insurance. It was sent to the insurance company. Insurance also paid the money because real problem was radical nephrectomy. And nephrectomy and prostatectomy had the same price. So insurance company had no issue and the claim was settled, right? So we should be careful, and we need AI, we need technology that can read the other corroborating factors and can warn us against these things. Technology could be dangerous. Now, sorry, 30 seconds I'll take in answering your question about cultural change. We complain more and more about the clinical adoption and doctors' non-cooperation. I was also thinking the same way. But for past 1 year, my thinking has changed. I think the technology people should learn a bit of medicine, and they must put their feet into the shoes of the doctors. Thank you so much. So that is how the change will come. We have to cross half the distance from this side and that side and meet midway.
Thanks, sir. And as far as because nowadays few initiatives by the government of India is coming up. Ayushman is one of the area, and from the regulatory compliance perspective, Disha is likely to come. As what's your readiness from your organization perspective related to this type of initiative? Ayushman is from the cost side, and Disha is from the compliance side. Because one hand we have a privacy as far as the patients are concerned. Second way, we have to give the best services to the same patient. Patient wants each and every time data control, and second time we have to send, other way we have to make the security of that particular data also. What's your thought?
It's a very good initiative, we can have a lot of controls and cost control as well. In terms of the readiness perspective, like we are in a process. We don't have, I cannot say right now we are compliant, but as a corporation, we are compliant with own processes, but we have to basically inline our processes towards the government processes, what all the guidelines and the compliances they are expecting from us. So the work already has been started, and I think so like within a 6 months time we would be in a position to say something about that.
Or you are taking this type of initiatives in your organization, because Sri Krishna panel is just in that particular Disha is in the draft phase. How you are taking this type of initiative? Because still it is not finalized.
Yes.
First of all, you have to do a training to your executive, your IT team, your company. Then how you will take care of awareness and this type of?
So first of all, like there is a compliance. There are only required compliances. What we do, like enable audit or like okay, you see your lab how it will come. multiply. So bit and pieces we were doing it. Then we have taken the certain blueprints from the different organizations. Like John Hopkins was one of the partners for us. They have basically given a lot of guidelines like how healthcare is basically comply, right, worldwide. So we have taken that blueprint, that framework, and then we have built processes over on that framework.
We have only 2 minutes.
Yeah. So to keep it short, let me tell you, it's a challenge for the private hospitals. It's really a challenge. We have different channels of patients, CGHS, EWS, and so many different type of channels. Already a lot of optimization has happened in the cost. So it goes more to the CFOs and the CEOs to see how it should be implemented. From the implementation point of view, is the business ready? I don't think so. If it comes to IT, it won't be challenged because whatever they tells us, we have to do that. But then we still need to see that happen. I think it's a challenge.
Shilpa.
Yeah, as IT is concerned, we are catering CGHS patient, DGHS, ECHS, then we can cater Ayushman also. The system is ready to configure that rate list and start taking that patient. But definitely it's a management call whether they want to go with Ayushman or not. So it's a challenge for the hospital.
So I think we should not limit ourselves to compliance. If our processes are really that ingrained in quality and excellence in care, compliance will automatically come. As far as communication is concerned, I think CIOs have a very critical role. So I keep sending those flyers every 15 days to everybody, and at 2 different levels, HOD levels and mass level, and keep educating them about the security, about different other process discipline, which are mandatory. I think we just need to expand on those things.
Okay, thanks a lot. We don't have much time as far as these sessions are concerned. Last statement is yes, digital transformation or digital health enterprise is a reality nowadays, and we all require this because our patient is in need of this type of initiatives. Thanks a lot.
Thank you very much. I believe, sorry, we cannot take a